Welcome to this week's episode of Ask Dr. Jessica. I am thrilled for today's guest, Dr. Pieter Cohen. He's been a longtime friend. How are you?
I'm doing great today, Jess. Thanks so much for having me.
It's really nice to see you. And just to give a little background, I've known Pieter quite a while. He's been a wonderful mentor for my husband. I think you were even at our engagement party back in 2006.
Yes.
So we've definitely known each other for a while. And as the years have gone by, Peter's been really taking a very interesting delve into the supplement world, which has become very popular. So just asking you, how did you become so interested in supplements? Where did this all get started for you?
It started with my practice. So I'm a general internist, and so many of my patients were suffering from side effects that they were experiencing from taking pills that I wasn't prescribing them. It was often, not infrequently, something to help them lose some weight. And what these pills ended up doing was landing people in the hospital sometimes, in the emergency departments, sometimes with chest pain or heart racing. It was interesting because what we found was that it wasn't just a problem here in Boston, but it was actually a national problem that there were supplements, weight loss supplements, that were spiked with drugs. We've basically spent the last well over a decade, more than a decade now, investigating what's actually in the supplements that are being sold throughout the United States, be it online or in stores. And we take a hard look at what's actually in the powder, in the pills. So I team up with analytical chemists who separate out the actual chemicals that are found in the supplements. We take a look at to see if they reflect what's on the bottle, what's listed on the bottle. So we look at what's supposed to be there in terms of what it says on the bottle and what we find. So the results are often really quite remarkable, and that's what we've been working on.
Just to have this clear, what is the FDA's role in the supplements? Like, is anybody actually looking at what's being put on the shelves?
Right. So I think first, that's good, Jess. And to help answer that, let's first take a step back and just define what we're talking about with these supplements, because that's often sort of area that's hard to imagine. So basically what we're talking about is all the products that are sold from a legal perspective. They're termed dietary supplements. And there's a long list of things that can be in supplements. So this is everything from vitamins and minerals, but it also includes botanical extracts, protein powders, amino acids, and live organisms too. So probiotics or live bacteria that are being sold as health products, those are also sold as dietary supplements in the United States. So all those different pills and powders are sold as supplements. And the situation in terms of how they're regulated is that unlike drugs, prescription drugs that need to go through an approval process, a company would provide evidence to the FDA that this drug is safe and effective, and then it can be prescribed by doctors. When it comes to dietary supplements, there's no approval process whatsoever. They're actually sold as a subcategory of food. And supplements can be introduced into the market entirely based on the manufacturer's word, basically, that they're safe. So there's no vetting of supplements, either that they are safe or that they work for their advertised intent prior to them being introduced to the market.
So literally, I could make a pill and write on the bottle and say, this will keep you from aging or make you look younger, and that would be okay?
Right. So very close, Jess. You would have to do a little bit of work. So basically,
okay.
But not much. So basically, what you'd have to do is a few things. You'd have to register your home, your basement, let's say, as a place that produces supplements, manufacturer, and then you'd have to abide by certain manufacturing practices, or that's the law. You're supposed to ensure that there's no that the place where you're producing those pills is sterile, for example. Some basic and that you write down, for example, what you're going to put into the pill and then you do that for all your pills. So you're supposed to be doing that on your own, and we're supposed to take, the consumer is supposed to take your word for it, that, you know, you just in your basement, making sure it's sterile, making sure that it's you're following these good manufacturing processes. Because the thing is that the FDA does some inspections, but they get to a very, very small amount of inspections compared to how many different companies are making supplements. So it's very likely that if you started doing that from your basement, you're unlikely to be audited by the FDA, inspected by the FDA. And then, yes, you could just go ahead and start selling your products. Now, in terms of your other point, though, like, can you say this will, you know, improve your health some way? Let's say make you think better, or enhance your cognitive function, let's say, help you study better, or help you lose weight. Can you say those things even if you're just producing these pills with some botanicals in your basement or your factory? And the fact of the matter is you can, because you do not need to do any studies to show that, hey, my supplement has a health effect, before you put on the label that it works. So it's really kind of backwards in terms of what we usually think of the process, whereby you would demonstrate evidence that something works and then advertise that effect.
Absolutely, especially in this day and age where I think it's pretty clear that, you know, we can conduct good studies and really try to provide good evidence that something works before we make a claim. But it seems definitely backwards.
Yeah, it does. Certainly for a health product. You know, I think about it like this, you know, if we were selling, if we wanted to go and start selling mattresses together, Jess, right? And we said, this will have you, you know, you'll have a great night's sleep and you'll never have another worry in your life. You know, I think that as a consumer, we know that, yes, having a nice mattress can help you fall asleep a little better, but it's not going to change your life, and it's not going to have, you know, some sort of profound health effects. What's different here, and what's a little more insidious about this advertising potential that the supplement companies have, is that we're talking about pills and powders that are swallowed, and we really have to take the word for it on the envelope, on the label of what they actually do. Because we don't taste them. It's not like traditional food where we're enjoying an apple and we know if this apple tastes great or not. So there's no taste, there's no smell. We're just putting this in our body and swallowing it. And with just the belief that whatever it says on the bottle or whatever we've read about it will work. And the fact of the matter is with supplements is that there is no, you don't need to have any proof that your supplement works in people, is effective in people, to make health claims. So it's really quite a disconnect between what's available on the label and then what the kind of data that backs that up.
What's so interesting to me is that given all that, the lack of data to back it up, they're so prevalent. So many people that I know religiously take supplements.
Yeah, I think that, it's that sort of like free reign to be able to advertise it for so many different health benefits that really gives a big momentum to the supplement industry, because you can really say that these products have benefits immediately to your health, as long as you avoid saying things like making disease claims, which are like saying this can cure diabetes or treat heart disease. As long as you avoid those kind of claims, pretty much any other claim you can market your supplement as. So that's a real that's a real advantage for the companies. And if you spend your time on strategic marketing, you know, making sure that it pops up on Facebook in the right groups, that on social media it's being promoted by the right people, you know, you can see that very quickly with the official looking bottles and these health claims. You can quickly get the idea that, oh, you know, I probably should be taking this for my health. But it's really just, in most cases, just marketing claims.
Now, are there any instances you can think of in what you've been reading and studying where supplements are actually beneficial?
Sure. You know, I recommend supplements to my patients all the time. So what is so important to understand is that when we understand this disconnect, it doesn't mean that there's no supplements that can help. Actually, supplements are also part of very important tool that we have in our medical toolbox, and we need them, and we need high quality supplements, and that's why I'm a big advocate for high quality supplements. But every day in clinic, I'll have a patient, at least probably more, that I'm recommending they take supplements. And the common situations are people that are deficient in a vitamin or a mineral, or might become deficient in those vitamins and minerals if they didn't take extra. The supplements are essential for treating very common problems like iron, like low iron levels. So low iron levels can cause one to develop anemia or a low blood count. And it's also important in some situations to avoid deficiency. So an example of that we commonly recommend supplements for is for women prior to getting pregnant. It's very important to have enough folic acid in your system, and that's why we recommend folic acid for women of reproductive age, ideally before getting pregnant, to make sure there's enough folic acid in the system. Here in the United States, where many foods are fortified with folic acid, we might not even need a separate supplement with folic acid because of the fortification. There's never been a well-done study that says, well, in a country like the United States where foods are fortified with folic acid, does additional pill help? So it's really a situation there that we're doing it. It's really only out of an abundance of caution that we would recommend folic acid in addition to your diet in the United States. And that's one thing to remember too. With most people, unless you have a very restrictive dietary pattern, or if you have some medical problem, you're almost assured to get all the vitamins and minerals you need by just eating in the United States. And that tends to work both ways. Like sometimes people feel like, well, if I'm rushing and I'm just eating out or I'm eating fast food, maybe I'm not getting all my vitamins. But generally in those situations, you're going to, because you're also there'll be fortification of those sort of processed foods. And if you're cooking at home using lots of fruits and vegetables or eating a nice balanced meal, then you're going to get your vitamins from those, which is even better. So yeah, we generally have enough vitamins and minerals available to us in our regular diets here in the United States.
So just to piggyback off of that thought, what are your thoughts on regular multivitamins? They're so common, they're so popular. Have you found that they're really necessary?
So there have been excellent large studies looking at the use of multivitamins in healthy men and women, adults. And what they found was that the multivitamin, the good news first is that the multivitamin won't kill you. It really looks like if you take a multivitamin for many years or you take a placebo for many years, it won't affect your lifespan. So it's not hurting you. But we don't really see any big benefits when it comes to heart disease. We don't see that multivitamin is beneficial when it comes to preventing cancers. Cancers overall do not decrease because you're taking a multivitamin. There's always intriguing hints that something might be going on. One of the latest developments is a large study that may come out in the near future looking at multivitamins and prevention of cognitive decline. So of course that would be very important if we find out in the future that it can help us with decreasing the risk of memory loss. That would be spectacular. But right now there's no proof that a multivitamin can help us. So it's really, but they don't seem to harm us either. So it's one of those situations where personally I don't take a multivitamin. I don't think it's worth the expense.
I think with pediatrics, the only time I see it being an issue is when I talk to parents about their children's diet, and they'll admittedly say, My child eats a lot of fast food or their diet's not the best, but it's okay because at least they're taking a multivitamin. So I do think it can provide a false sense of security that their children are eating well and that they don't really need to try any harder to get those fruits and vegetables in.
Yeah.
But I agree with you.
Yeah,
it's not a
Jess, I
battle to fight.
completely agree with what you're saying, and that's very important to point out, because there's never been any study to suggest that in other words, you replace a serving of vegetables or you replace a serving of fruit a day with a multivitamin. No one would ever do that study, because the companies would never do it, because the chance that they could demonstrate that the multivitamin is better or even equal to a serving of vegetables or fruit is so unlikely that they wouldn't produce it. And physicians, the NIH probably wouldn't support a study like that, because it would appear to be unethical that we would take away a helping of fruits and vegetables. So the idea that a multivitamin can replace fruits and vegetables is completely false. There's no evidence to suggest that's the case.
Right. But to your point, I think you make a good one. It's unlike the situation you started off talking about with your patients that were having harm from their supplements. Multivitamins aren't the worst thing.
Precisely. I don't really spend much time discouraging anyone from taking a multivitamin. Although if they were to ask, I might tell them it's not necessary for them if they're healthy.
Can I ask you just about some of the most common supplements that parents ask me about in general?
Sure.
The first being, a lot of people hate getting colds. They want to do whatever it takes to prevent colds. And there's a lot of supplements that are marketed to help get over colds, like Umca and zinc. Is there any evidence that any of these supplements are beneficial for colds?
Well, in the case of some of these ingredients, like zinc, there's usually a small study or some small interesting data. The sort of data that as a physician we'd be like, wow, that's really interesting. That deserves more study. Because what we know about medications, and that the same goes for vitamins, botanicals, and minerals like zinc, is that it's not like you just have some of this stuff and it does its job. Like, you need to figure out what's the right amount, what's the right dose. Because if you have too little, it's not going to work. And if you have too much of anything, really, like caffeine's a good example, it can certainly harm you. So in the case of some of these ingredients, there's early preliminary data that sounds intriguing, but it hasn't been yet ironed out to the level that we know this amount of this ingredient will prevent a cold, or this amount of this ingredient will help you get better from a cold. So that's why I don't recommend those supplements for my patients to either try to prevent colds or treat them. And also the other problem is that relates to that dose issue is that when supplements are being sold, the manufacturer can formulate them with any amount of the ingredients that they want. And as I mentioned, it's really a specific amount we would want for a specific benefit, if a benefit exists. And when you can't tell how much of something's in the supplement, and what we find in many studies is that what's listed on the label, even if there's a specific amount, is very unreliable. I don't find that supplements are a good place to go here for all those reasons. Preliminary data, sometimes no data to support it, and the unpredictable amount of the ingredients and supplements. All this causes me to pause before advising taking supplements to try to prevent a cold or get over a cold faster.
I feel like things like vitamin D, calcium, fish oil, those seem to be pretty standard recommendations now for many Americans. Where do you stand on supplements like that?
Well, fish oil, I am not, I don't really see a big role for fish oil. Certainly if you're healthy, I don't see that fish oil can, it's not going to be a game changer, let's put it that way. And I do think getting a fish into your diet and cooking up fish at home is definitely recommended. And again, I wouldn't replace like think that using fish oil gets you off the hook for having a balanced diet, and including fish in that diet. So there were some studies. There are studies in terms of people with heart disease in the past showing that some fish oil preparations can be helpful, but it looks like today that when people are treated with modern drugs for heart disease, that really benefits them as much, and the fish oil doesn't seem to add much on top of that. So, I haven't really recommended fish oil to my patients in quite some time. In terms of vitamin D and calcium, these are very important vitamin in the case of vitamin D, and mineral in the case of calcium, to consider. It's important to get enough calcium, and ideally you get that from food. Of course, some people for reasons like lactose intolerance might have difficulty in getting enough from their foods, and in that case it might be good to supplement a diet with calcium. So that's something good to talk to your physician about. And the same with vitamin D. Vitamin D levels. The problem with vitamin D is that there is a subgroup of people who have vitamin D levels that are too low. The problem is that subgroup is often exaggerated, or it's not even when people go to the doctor and get their vitamin D level checked, the lab reports will not infrequently say that someone's low when they're not actually. It's very complicated and controversial, but basically very low vitamin D levels can have a lot of health consequences and definitely should be supplemented, but slightly low levels of vitamin D, not so much. One doesn't need to then just jump to taking a vitamin. And again, like we were talking about earlier, you could have some foods that are fortified with vitamin D instead, and that will cover your bases.
And just for clarification, that very low vitamin D level that you're referring to, just are there numbers that you have in mind? I know a lot of parents get their labs back and they see a number 26 or they see a number 18. What actually classifies as a low vitamin D to you?
Right. So properly low would be, and I don't know about for the kids, Jess, you'd have to add that, but for the adults, it's less than 20. So if a vitamin D level is in the teens, I would recommend getting extra vitamin D from a pill, a supplement. And certainly if it's lower than 10, that's really serious. And you need really high dose vitamin D, and really should be talking to your doctor and having that followed very closely.
So it sounds like what you're saying is that your first preference is to try to get all of these benefits of vitamins and minerals from a natural source, from fruits, vegetables, actually eating fish, getting calcium and whatnot naturally. And if you can't get it and you're truly deficient, then a supplement in this category would be okay in your mind. Is that right?
Yeah, you got it precisely. and the only thing I would add is that's the case for a healthy person. And just remember that if your physician recommends you take a vitamin or a mineral, then that's another indication, because it might be you have a medical condition that it's important for you to take it. So, but that's perfect advice for healthy people. There is really, it's unusual that healthy people in America can't get the sufficient vitamins and minerals from their food, unless they have a very restricted diet.
Okay, that's great to know, because I think so many people see supplements marketed, you see them advertised, and we all want to do the healthiest thing. And if there's not evidence to back it up, I definitely would prefer to stay away.
Yeah, I agree. What I would like to see, because I think there's no reason why we shouldn't, as consumers in America, have access to a wide range of vitamins and minerals and botanicals. I think that's great, because I think if a consumer wants to try something, that's fine. My concern is twofold. One is that to make sure it's safe. I want to make sure that it's safe and accurately labeled. Both accurately labeled in terms of what's on the label should be what's in the bottle, and accurately labeled in terms of avoiding false or bogus or exaggerated health claims. those things do not help us as consumers. So we should have wide access to products. So that gets me to some of my tips about if you are going to use supplements. I really recommend a few things. One is that not to just buy supplements that list an ingredient, ideally an individual single ingredient on the label, not a mixture of different things, and that there's no health claims on the label. It doesn't say this will boost your immunity or help you lose weight. Just list, what it is. And if you've read up about a product or a botanical and you like to try it, then I would only buy that individual ingredient, not something that's promoting other things. And then there's a few third-party certifiers that help us get a little better handle on the accuracy of the labels. So you could look for a USP, for example, US Pharmacopoeia stamp on the supplement bottle. And those supplements have gone through vetting. The companies have paid for a third party that's very high quality to look at their supplements. And for sports, for example, there's NSF for sport, which does the same thing. So those are really some tips that people, for if you do decide to try supplements, that's my advice, to stick with single ingredient supplements and go for things that have a very high quality third party certification like USP and NSF.
Definitely keep those in mind if I ever buy a supplement. And Peter, if you could design regulation over these supplements, how would it look to you? Would you have the FDA play a different role?
So if we were to have a sort of common sense reform, what we'd want to do is make a lot of changes that would ensure prior to a product getting on store shelves that it's safe, and eliminating the ability to sell something under false pretenses. It's important for people to understand that in order to have safe supplements in the future, we're going to need to seriously reform the law. So it's really important to stay attentive to that. And when there are bills and proposals out there to reform the supplement law, to really seriously consider them and decide, is this something that's going to move to making sure we have a safer marketplace for supplements?
When you give advice to your patients about how to stay healthy and how to have a healthy lifestyle, what are your general principles? How would you advise? Just good old-fashioned eating healthy and exercise?
Yep, you got it. So home cooking whenever possible, starting from a diet that's built on a lot of fruits and vegetables, nuts and fiber are terrific too, and getting a lot of exercise. So making sure you get exercise, the equivalent of maybe half an hour more a day of exercise, both exercise that's cardiovascular as well as exercise that's going to help build up strength and muscles.
And I just want to close by saying Peter definitely follows the advice that he gives. I know whenever I'm with you, we're eating good home-cooked meals. And I also know whenever my husband whenever you would talk about, you need to have meetings, you were very famous for walking and talking, right? Even in, I remember Boston, even in those cold winter days, you guys would have talks and walk at the same time. So
yes, and I think Jess, not just walking, sometimes even jogging. So you can ask Mike, but I think that he'll remember a jogging meeting we had as well. So yeah, we try to increase the cardiovascular activity to the maximum capability of the attendees.
Any last tips? Any last thoughts before we sign off?
Nope. Just to remember to stay engaged and thinking about the safety of supplements, because it's often that the manufacturers like to frame the problem that they're people who are trying to get supplements off store shelves so we don't have access, and against people who want access, and that's not the case at all. What we need access to supplements, but we also need to make sure they're safe. So it's really important to keep your eyes open for reform, and to advocate for reform that'll keep access to supplements and ensure that they're safe and not falsely marketed.
It seems so logical, and it seems like it should be happening already, but I'm glad that you're making steps to make sure it happens.
Thank you.